Hi and welcome. Today's topic is one that could make all the difference in your life, or the life of someone you care about. We're going to talk about what to do if you experience a heart attack while you're alone at home. It's a frightening thought, but I want to reassure you right from the start. This conversation isn't meant to worry you. It's meant to give you strength, clarity, and confidence. Heart disease is the leading cause of death for adults over 65, and more than 80% of heart attacks happen at home. That's not just a statistic. For many seniors living alone, it's a reality that makes knowing how to respond absolutely critical. The minutes after a heart attack begins are often the most important, and what you do in those moments can dramatically change the outcome. But this is not about fear. It's about being ready. It's about taking control when everything in your body might be telling you to panic. And believe it or not, there are simple, proven actions that can help keep you alive long enough for help to arrive. In this video, we'll walk through 7 essential steps you can take if you ever find yourself facing a heart attack while alone. These aren't complicated medical procedures or vague advice. They're clear, practical actions backed by medical research and heart specialists. You'll learn how to recognize the early signs that something is wrong, the most critical thing you must do first, and how to stay physically and mentally steady while you wait for help. And because real stories often stay with us longer than facts alone, we'll also share moments from people just like you, older adults who faced the unthinkable, acted quickly, and lived to tell the tale. Take Carol, for example. She's 76 and lives in Arizona. One evening, she felt a strange sensation. Not sharp pain, but more like a heaviness in her chest, almost like someone was pressing down on her. She wasn't sure what it was, but she remembered a conversation she'd had with her doctor about symptoms that women often experience. So instead of brushing it off, she picked up the phone and called 911. Paramedics arrived within minutes. Her doctors later told her that acting in those first 3 minutes likely saved her life. She didn't hesitate. She didn't waste time wondering. She trusted her instincts and the information she had prepared for moments just like that. This video is here to help you do the same. It's not about memorizing medical terms or becoming an expert in cardiology. It's about knowing what to look for, how to act, and how to stay calm when the world feels anything but. So I invite you to stay with us. Listen carefully. Take mental notes or jot things down if you'd like. The steps we're about to cover are not just important. They're potentially life-saving. And no matter your age or your current health, the knowledge you gain today could serve you tomorrow. Let's begin with the very first and often most misunderstood part of surviving a heart attack alone: understanding what it feels like. Because it's not always what people expect. Step 1. Recognize the early warning signs fast. It doesn't always feel like a heart attack, but when it does, it can catch you off guard. In fact, the symptoms in older adults are often subtle and easily confused with something else, like indigestion or a general feeling of discomfort. This is one of the reasons why recognizing the early signs is so crucial. It might not always be obvious. Common signs that something's wrong include chest discomfort, pain in the arms or jaw, shortness of breath, sweating, nausea, and dizziness. These can vary from person to person, and sometimes they might even seem like something else entirely. If you feel a pressure or heaviness in your chest, it might feel like a bad case of heartburn or just fatigue. It's easy to brush it off, especially if it doesn't come with the sharp, intense pain that you might expect from a typical heart attack. But even a mild or unusual feeling in your chest deserves attention. Women in particular might experience these symptoms in a much less obvious way. For many women, a heart attack might not come with the crushing chest pain that we often associate with it. Instead, they may feel nausea, shortness of breath, or even just a sudden wave of fatigue. These symptoms can easily be mistaken for something benign, like indigestion or stress. If you're ever in doubt, remember this: when in doubt, check it out. Another important factor is the presence of silent heart attacks, which can occur without the dramatic symptoms we're used to hearing about. For many older adults, heart attacks can be quiet, meaning the symptoms are so mild that they go unnoticed or are brushed off. This is why it's essential not to ignore even mild signs, especially if you've experienced any of the common warning symptoms. Let me share a real story to bring this into perspective. Diana, a 70-year-old from Florida, had a moment just like this. One morning, she felt a discomfort in her chest, which she assumed was just gas or maybe something she ate. She had no crushing pain, just a strange sensation. But then she remembered her doctor's advice about listening to her body, especially since heart attacks can feel different as we age. She called 911, and it turned out she was indeed having a heart attack. Because she acted quickly, Diana received the care she needed in time. Now that you have a better idea of what to look for, the next question is, what should you do next? Step 2. Call 911 or your local emergency line immediately. The call to 911 can be the difference between life and death. The sooner you get medical help, the better your chances of survival. In fact, research from Johns Hopkins shows that early intervention, especially within the first 90 minutes of a heart attack, can double your chances of surviving. Every minute counts, and the faster you act, the more time doctors have to minimize damage to your heart. If you think you're having a heart attack, don't hesitate. Pick up the phone and call 911 immediately. When you do, it's important to stay calm but be clear about your situation. Tell the dispatcher something simple and direct like, "I think I'm having a heart attack. I'm alone. My address is..." This will help them assess the situation quickly and send help right away. If you're feeling weak or unsure, just remember, they're trained to handle these calls, and every second you wait can make things harder on your heart. There's one thing you should absolutely avoid during these critical moments. Don't drive yourself to the hospital. It might seem tempting, especially if you're thinking the symptoms might go away. But that's a dangerous decision. Driving during a heart attack could put you at risk of fainting or losing control behind the wheel. Also, don't wait and see. Heart attacks don't get better on their own, and never brush it off as something minor. James, an 80-year-old from Illinois, knows all too well how much of a difference time makes. When James began feeling chest pressure, he didn't immediately call for help. He thought it might pass, so he waited. After 40 minutes, he finally dialed 911. When he got to the hospital, the doctors told him that even waiting just 10 more minutes could have caused significant damage to his heart. It was a sobering moment for James, and a reminder that there's no time to waste. While you wait for help to arrive, there are steps you can take that could help keep your heart stable and buy you more time. Step 3. Chew, don't swallow. An aspirin. One simple pill could make all the difference. If you suspect you're having a heart attack, chewing an aspirin is one of the easiest and most effective things you can do to buy yourself time. The reason why this works is that aspirin helps prevent clotting, which is often the cause of the heart attack. A 325 milligram aspirin, chewed rather than swallowed, gets into your bloodstream much faster, giving you a better chance of minimizing the damage to your heart. However, there is an important safety note to remember. You should only chew aspirin if you're not allergic to it and if you're not already on blood thinners. For some people, taking aspirin can cause serious complications, so it's important to be aware of your medical history and any medications you're currently on. If you have any doubts, consult your doctor about keeping aspirin on hand just in case. To make sure you're prepared, keep aspirin in a spot that's easy to find and access, somewhere visible and clearly labeled for emergencies. This is especially important if you're living alone and may not have someone else to help you in the moment. Helen, 84 from New York, has taken this advice to heart. She keeps a bottle of aspirin taped inside the kitchen cabinet door with a simple label that says, "For heart, chew only." That way, if something happens, she knows exactly where to find it, even in the panic of the moment. Now that you've taken a step to help your heart, let's talk about how you can stay calm and keep your body supported while waiting for help to arrive. Step 4. Sit down, stay still, breathe slowly. In moments like this, stillness is your greatest ally. When you're feeling the weight of a heart attack, it's natural to want to move around or try to take action. But the truth is, the more you move, the harder your heart has to work. Sitting down or lying back with your head elevated helps to ease the strain on your heart, allowing it to beat more efficiently. The goal here is to reduce the workload on your heart so it has a better chance of recovering until help arrives. Avoid any physical exertion. Don't try to walk to the door, grab your shoes, or even get up to check the phone. Every unnecessary movement can increase the stress on your heart. Instead, find a comfortable place to sit or lie down. Keep your head elevated to make breathing easier and to reduce strain on your circulatory system. While staying still, focus on slow, steady breathing. This is where a mental strategy can also be incredibly helpful. Simple, calming phrases like, "I'm okay," or "help is on the way," can help ground you and reduce anxiety. Deep, slow breathing not only calms your nerves, but also helps your body get the oxygen it needs to function. Repeating comforting words in your mind or out loud can shift your focus and help you stay centered in the midst of the chaos. Mark, 75, from Nevada, experienced a moment where he didn't follow this advice. In the midst of his heart attack, he panicked and tried to get up to unlock the front door. His pulse shot up, and he could feel his heart racing even faster. In hindsight, Mark says, "I should have just stayed put." Staying calm and still would have helped his heart work more efficiently, and he now shares that lesson with everyone he meets. You've done your best to slow down the damage, but there's more you can do to increase your chances of survival. Step 5. Loosen clothing and unlock the door. Making it as easy as possible for help to reach you is another critical step in improving your chances. One simple but important action is to loosen any tight clothing. If you're wearing a belt, a tight collar, or anything restricting your chest or abdomen, it can make breathing more difficult and increase the strain on your heart. Loosening these items can help you breathe more easily and reduce the pressure on your circulatory system. If you're able to do so safely, unlocking the door is another helpful step. This might seem like a small detail, but if help arrives and you're unable to open the door yourself, it can waste precious time. If the door is close by and you're able to unlock it without putting yourself at risk, take the moment to do so. However, if you feel weak or unsteady, don't force yourself. Your safety is the priority. If it's nighttime and you can, turning on the porch light can help emergency responders find your home more quickly. A small, simple action like this can help them identify the house and reduce the time it takes for them to reach you. Nancy, 79, from Washington, has a clever safety measure in place that could save valuable minutes in an emergency. She keeps an outdoor lockbox marked EMS only with a key inside, so emergency responders can access her home quickly if needed. It's a simple but effective idea that could make all the difference if seconds matter. Now that you've taken these essential steps, it's time to think about what happens if help takes longer to arrive than you expected. Step 6. Text a neighbor or family member if possible. Once you've called 911, if you're able to, sending a quick text to a neighbor or family member can make a big difference. A short message like, "911 called, possible heart attack," at home can inform someone else of the situation. This is especially important if you become unresponsive while waiting for help to arrive. Having someone else aware of your condition means that they may be able to help or assist EMS when they get there. It's also helpful to have your emergency contact information saved in your phone under ICE in case of emergency contacts. This allows first responders to access important numbers in case you're unable to communicate. Keeping your phone nearby at all times is another simple but crucial step in preparing for an emergency. If you are conscious but unable to call for help yourself, someone else might be able to make contact for you. Leo, 82, from Missouri, was able to text his daughter after dialing 911, letting her know what was happening. His daughter quickly made her way to the hospital, arriving just in time as Leo was being wheeled into the emergency room. In moments like this, knowing someone is on their way can provide peace of mind and ensure that you're not facing the situation completely alone. Now that you've taken steps to inform those around you, let's move on to the final step, which is often the most underrated but crucial. Step 7. Mentally coach yourself to stay calm and present. In the midst of a heart attack, your mind can play a pivotal role in supporting your body. Panic increases the stress on your heart, making the situation even more challenging. When you're able to stay calm, you reduce the strain on your cardiovascular system, giving your heart the best chance to recover until help arrives. The more you can ease your mental state, the better you'll be able to help your body stay as calm as possible. A helpful strategy in moments like this is to practice affirmations. Repeating phrases like, "Help is coming," "I've done all I can," "I'm okay," can give you the mental clarity you need. These simple words can focus your mind on what you can control and help you fight off the anxiety that can worsen the physical symptoms. Remind yourself that you are taking the right steps and that assistance is on the way. Positive affirmations can have a real, calming effect, allowing you to stay centered in a chaotic moment. Deep breathing is another valuable tool in your mental toolkit. Slow, deep breaths can activate the vagus nerve, which helps slow your heart rate and stabilize your rhythm. Breathing deeply in a steady pattern not only calms your nerves, but also provides your body with the oxygen it needs to maintain optimal function. Betty, 77 from California, has learned to coach herself through moments of anxiety. When she feels panic rising, she repeats, "I've got this." This simple phrase, shared by her cardiac therapist, has become a mantra that gives her the mental strength to remain calm during stressful situations. Betty's advice is something many seniors find invaluable. Your mind can be just as powerful as your body in times of crisis. With all these steps in place, you are doing everything you can to improve your chances. Now let's take a moment to review the 7 vital steps we've covered today, so they're fresh in your mind. First, recognize the symptoms. Pay attention to chest discomfort, jaw pain, nausea, and shortness of breath. Trust your body, and when in doubt, act. Next, call 911 immediately. Don't wait and don't drive yourself. Early intervention can double your chances of survival. Then, chew an aspirin, unless you have specific medical reasons not to. This simple step can help thin your blood and prevent further damage. Sit still and breathe slowly. Help your heart by reducing stress and giving it time to recover. Loosen any tight clothing and unlock the door if you can safely do so, making it easier for emergency responders to reach you. Send a text to someone you trust so they can be aware of your situation. Lastly, mentally coach yourself to stay calm. Repeating affirmations and breathing deeply can help stabilize your heart rate. You don't have to memorize all of this, but just knowing these steps can make the difference between life and death. It's about staying calm and prepared, so you're ready to act if needed. It's also a good idea to talk to your doctor about your heart health and set up an emergency plan. Have aspirin within easy reach and discuss your risks so you can take proactive steps together. Before you go, if this video has helped you feel more confident about what to do in an emergency, please take a moment to like and subscribe. Your support helps us reach more people with important, life-saving information like this. And don't forget to share this video with someone you care about, because when we look out for each other, we all benefit. Thanks for watching and stay safe.